Welcome back to the Soft Tissue Revolution podcast, version 2.0, where we teach manual therapists a new treatment system that focuses on working smarter, not harder, which will allow you to cut your treatment times by 50% so you can stay healthy and help more people get out of pain. My name is Dr. Matt Maggio. Thanks so much for stopping by and checking out the podcast. Glad to be back. If you didn't listen to last week's episode, I brought the podcast back, version 2.0. Going to be focusing more on some real talks, maybe try to motivate you, even though motivation might be bullshit. Handling clients that are a pain in the ass, ranting about stuff, sharing some stories. Really just want you to be able to, get a kick in the ass that you need sometimes and be better, because at the end of the day, excellence is what pays, and excellence is what the world needs, and the world needs more problem solvers. If you're looking for more like the clinical aspect of what I do a lot more of that on my YouTube channel, on LinkedIn. We also have a free training module and document that we go through that goes through the whole system. We do have CEU credits available as well for training and massage therapy, all that stuff. And more of the clinical stuff, like I said, treatment, evaluation, patient communication, all that kind of stuff is available on those other platforms. This is just more of me, a place for me to share some thoughts and some ideas and maybe rant just a little bit. So now I got done with all that stuff. The question I want to bring up this week is, how long is your current treatment load sustainable before you can't work anymore? So, why did this one come up? I remember a couple weeks ago, I think I got a message from somebody. I don't remember where it was. I get a couple of these messages a week about, hey, I'm working these long, crazy hours. My body's beat up. I'm in pain. I don't know what I can do. I don't know how much longer I can keep this going, but I got to pay my bills. I got to take care of my family. I have to make a living. I think this person was telling me they're working like 10 or 12-hour days, and they're having to basically, I think they said tape up their wrist or their hand in order to just get through the shift, and then they're really beat up, but they had a lot of other responsibilities going on there. And we're really bad about this as manual therapists and body workers. We beat the hell out of our bodies, and a lot of us that got into this profession, I know myself, is I really fucked myself up. When I was in high school and college, I played football and beat the shit out of my body. So I'm all jacked up. I'm 37. I'll be 38 here in a couple weeks. And I got blown out discs in my back, blown out discs in my neck, all over the place. And what happens is we get in this pattern, and I've been there before, and it's destroyed me. And I'm still trying to work on my health and get my health back because I fucked it up for so long. And we get this idea of we can continue to do what we're doing forever. We think we can continue to redline it, and eventually it's going to get better. There's this fallacy that we have as humans. It's called the when-then fallacy. It's this idea of well, when I start making more money, then I'll start to save money. Or once I have more time, then I'll actually stop working more. It's this whole idea. It doesn't really make sense from where you're at or where you're going. And it just puts you in a really, really bad spot. So a quick story I'll share with myself. What was it? This is going back 2018, probably September 2018. And I was, really humming in practice, but I was getting beat up. I was seeing 80, 90 patients a week. You're probably that's a lot. I'm fuck yeah, that's a lot. And I had someone working for me as well. Clinic was doing great. Shit, we were doing 50, 60 grand a month, all cash based, and was going great. But I was crawling out of there every day. I would work these long hours. I'd want to see all these people. I'm I just got to make money. I just got to get through it. Once things get better and I get in a good place and I'm financially okay, then I'll rest and I'll take it easy. Never happened. Just kept redlining it. And I would have these episodes where my back would flare up or my neck would flare up, and I'd have to miss 2 or 3 days of work, and just kept going. And I kept ignoring everything. I kept ignoring what was going on with my body, not listening to it, just being a real jackass about it. Just thinking, what, I'm going to keep going, but eventually I'll deal with this and figure it out. Then it all just fucking blew up. It just blew up one day. My back got horrible. My neck got horrible. It just wouldn't recover. I kept thinking, oh, I'd be okay. I'd redline it a little bit, then I'd back off just a tiny bit for 2 or 3 days. I'd get some treatment. I'd be like, all right, I'm okay. But then I'd go right back into all those problems again and again. And what happens is eventually you just run out of that buffer. You think, oh, well, I'll be okay if I rest for a day, then I'll go there. But then what happens is now you're going to have to rest for 2 days. Then you have to rest for 3 days, 4 days, 5 days, 6 days, 7 days. You see where I'm going with all this? And before you know it, you're done. You can't do anything. And that's what happened to me. I really fucked things up and I couldn't do anything. My back just wouldn't come around. I'd be working on a client or a patient for, 2 or 3, I'd see them. And then I couldn't do it anymore. I'd have to lay down on the floor for an hour. And then eventually it just got so bad. I was like, fuck, I can't do this at all. So this is where people really fuck up. And I fucked it up the most is we don't realize that we can go from this high point all the way down to zero. And that's what happens because your body is your business and what you do is important. And if your body ain't right, you can't do what you need to do. And you're very delusional. And that's me saying it myself. I've been delusional myself, thinking you can continue to keep up this pace and this load for where you're at because we're like professional athletes. We got a short time frame when we can actually do stuff. But if we try to load ourselves up and beat the shit out of ourselves, we're never going to actually have that time to recover and do what we need to do. And it can really mess you up. So what happened for me is I couldn't practice at all. I was out. I was out of commission. I had to, what did I have to do? Oh, my mentor who taught me everything, he was a person that really was good at treatment and all that stuff. So he was in Boston. So I had to fly from Florida to Boston every 2 weeks for probably 2 months just to get myself back in order. I wasn't able to practice. And the other thing there, I wasn't able to be in the clinic either. So the person who was working for me, they started, slowing down a bit because they didn't have me as their mentor and their guide. So I went from $60,000 a month down to $5,000. That's a huge decrease in revenue. And I had a lot of mouths to feed. I had a big staff. I had people that depended on me. And what I did was I was just really ignorant and I thought I can continue to go forever. And I know you're probably saying that to yourself too. You're like, I know this is bad. I know I got to do something different, but I'm stuck because if I don't stop doing what I'm doing, I'm not going to make as much money. My kids, my family, whatever can be in a bad spot. And I just can't do that. But what's going to happen is if you continue to put the blinders on and go down that path where you lose everything, then everybody's fucked. There's this mantra that I follow and it really helped me after I kind of came back after realizing the importance of my own health and taking care of myself because you have to help other people. It's the idea called lions eat first. And the idea behind that is in a lion pride, what happens is who's ever the head of it has to eat first because their job is to protect and take care of everyone else. And you have to be the lion yourself. You have to take care of yourself instead of giving all your energy to everyone else because if you're out, then everybody's fucked. And so many people ignore their own health and sacrifice for everyone else. And they think they're being noble and they think they're being valiant in what they're doing. But really what you're doing is being selfish by not taking care of yourself. You need to be selfish. But the idea of taking care of yourself and doing things the right way. So you're probably saying to me, you're like, all right, I get it. I know I need to cut back, but I'm booked up. People are coming in. The money's good, which is nice, but I just don't know what I could do. And that's what I talk about. I said in the intro, I teach you how to work smarter, not harder. This isn't a plug for you to take my courses or learn from me. It's just an idea of you have to find a way to take the load off of your body. And that's what I teach in my system, work smarter, not harder. It's very evaluation and figuring out the problems and working less, but more effective. As manual therapists, you just do too much fucking treatment. You just want to do everything and work on someone for an hour, 2 hours. I don't know what the fuck you're doing. You're just doing so much in there. And you want to get the right amount of dosage just right. And then have the time and freedom to take care of yourself and not get down that hole because you're going down a path that you're not going to be able to get out of. And then you're going to burn out and you're going to be like, well, the profession didn't work for me. It's you need to you need to treat yourself like $1 million racehorse. You have to take care of yourself. You got to move. You got to eat right. You got to get treatment. And if you're a fat, disgusting slob like I used to be and you don't take care of yourself, you're fucked. You have to make your health your number one priority because if you go down this path, you're going to be fucked and you're not going to get where you need to be. And that's what we teach you in the system. I teach you how to get out of I guess it's the trap. I call it the golden handcuffs, this idea of selling your time for money. it's not going to work, and it's not going to be sustainable because you're not going to be able to continue to see that load. And then that money's going to go down even less and less and less. You're going to be able to work less and less. And then eventually you're not going to be able to do shit. Then you go to zero. I want to keep you from going to zero and actually going up by doing better quality work, more effective, but less treatment so you don't beat the shit out of your body. So I think that's all I got for this week and ranting and all that stuff. But like, I've been there. It sucks, and I was just very delusional. I kept thinking that I could keep that pace going forever, and the universe kicked me in the nuts, knocked me down, and was like, nope, you're not going to do that because you're not being realistic. So be realistic with what you're doing and understand that you got to figure out a way to do it better, do it smarter, more efficiently. And I always say when I train and coach people, if you're doing your treatments right or you're running my system correctly, at the end of the day, you should just be more mentally tired and less physically drained. If you're physically drained, you're fucked. You can't do anything. Mental, I can just go home and relax and I can chill out. My body isn't beat up all the time. I'm not dreading going into the next day. I'm not having to do a million things to get it ready for the day and get my body ready just so I can go beat the shit out of it, then go home and lay back down and do it all over again. That shit's going to fuck with you and put you in a bad place. So be realistic about what you're doing, where you're at, and how long you can really sustain this, and just learn to work smarter, not harder. That's all I got for you guys. I appreciate you, and we'll talk to you on the next one. Bye. Thanks so much for listening. If you want help on the path to being able to double your income, all while working 50% less and being taken seriously as a healthcare provider, I have some great resources for you. Number 1, get access to our free training modules and introduction to my system, the Peak Method. Number 2, subscribe to our YouTube channel, The Soft Tissue Revolution. Links to all of this can be found in the show notes. Lastly, if you like the show, please leave us a 5-star review and share it with others that you know it could help.